Okay, at this time, I call the Community Service and Public Safety meeting to order. Karen, have we met FOIA compliance?
Yes, sir, we have.
All right. Could you call roll call for us, please?
Certainly. Mr. Lennox,
Here.
Mrs. Becker,
Here.
Mr. Grant.
Here.
Thank you.
Okay, thank you. Approval of minutes for the August 24th, 2020.
Mr. Chair, I would move to approve the minutes as presented.
Okay. All right. And a sign of just raise your hand, because I think it was only two of us at this particular meeting, correct? All right. So two? All right. Bill Harkin is out today due to sickness. All right. Citizen comments. Karen, do we have any citizen comments for today?
Mr. Chairman, public comments concerning today's agenda items were to be submitted electronically via the town's open town hall portal. The public comment period closed Friday, September 25th at noon. At the conclusion of the open town hall, there were 6 comments. No citizens signed up to speak at today's meeting.
Okay. Thank you. All right. Unfinished business. There are none. New business, fire, the 2019 fire rescue annual report and 2020 fire rescue mid-year update. Do you have anyone to present at this time? Okay. Good morning, Chief.
Hey, good morning, everyone. So today I'm going to present our annual report, which dates back to 2019, which seems like a long time ago. As you recall, as part of our international accreditation, we are required to report to our elected officials at least annually, and typically we do it twice a year. We do it in the spring, and I report on the previous calendar year, and then I come in September and report on the first half of the calendar year. And so today I'm going to do both. I'm going to give you a brief overview of 2019, and then we will finish up with what we've been addressing over the last 6 months here in 2020. I sent you the presentation, and you have a copy of the annual report. So I'm going to move through the presentation pretty quickly. A lot of it is charts, and I'm not going to spend a lot of time, but if you have questions, please stop me. But in the interest of your time, I do intend to move fairly quickly. So let me share my screen. So do you all have the PowerPoint?
I see it.
Okay.
Yes.
Yeah, they said they do. All right. So, like I said, we're going to look at our statistics from calendar 19, and then we'll jump into the first half of 2020, which runs through June 30th of 2020. We'll look at some accomplishments. Like I said, I'll give you the mid-year update on this meeting, and then we'll talk a little bit about where we're headed over the next 6 months. So last year, at the end of 2019 calendar year, we had our highest number of runs in our history, just shy of 7,900. So you can see the trend with, like I said, with a good economy and the island development and things like that. We've been busy, certainly on the medical side. So that's just a chart there to show you the 5-year increase. We went up with Hurricane Matthew in 2016. Stayed fairly consistent, and then we had an increase last year, as I mentioned, to the 77,800. So some standard charts we show you every year. This is just our call total by month, and you can see there's no drastic changes there by the chart. Day of week, our calls similar over the years. By time of day, 3-year comparison, obviously during the day, that's our busiest time. tends to drop off there at midnight. So this is typical of most fire departments you see around the country. So as we talk about fire and EMS calls, as you know, we are busy with EMS, and that's roughly 80% of our call volume. So here you see, as we code our calls in our system, last year 5,500 plus were EMS related calls, and 2,300 were some sort of fire related call, hazmat, fire alarm. The fire calls, that doesn't mean there was 2,000 calls for fire specifically, but it encompasses everything outside of EMS. And that's, in a fire department that runs EMS as we do, provides transport, that's typically 70 to 80% of your call volume. So to look back at 2019, the fire statistics, this is a better reflection of how our calls are coded. The 84 you see on this chart that are coded as fire, where something was actually on fire, whether it be a brush fire, a grill fire, stovetop fire, house fire. The orange is our EMS that goes above 5,000. And then we have some other calls related to our coding. As you see, service calls at 800, those can be smoke investigations, things like that. And then the green is the false calls, which we still have around 900 to 1,000 false calls. Many of those are false alarms a year. So that's kind of a breakdown of the fire side. This is just a chart to show you our workload of our apparatus by our fire station zones. And you can see by the chart, there's two, the engine 1 at Shipyard and the engine 5 at Hilton Head Plantation are your two busiest engines as far as response totals, and then the workload levels off somewhat between the other 5 stations. And this is the chart that shows you the calls that come in by the fire station zone, which matches up to our engine number. So station 1 you can see is at 21%, station 5 is at 16%. Those are the two busiest stations for our fire engine response, and then the other stations are pretty close as far as somewhere between 9 and 16%. So as we finished out last year in 2019, we always give you a summary of property loss that's over 25,000. So these are typically the fires that had the most property loss. And on the side there, you can see we've tried to identify the type of property for you a little better. So we had a single family home. And actually, most of them were, except for the restaurant on Palmetto Bay, which was the smokehouse. In 2019, the biggest fire loss was in the private homes and one residential complex on Matthews Drive. So our annual burning for our open burning requirement, you can see, I tell you each year as we move on, we started this in 2014 and it's become somewhat the normal operation of our duties here. And you can see the permits have come up to about 471 last year. Those are permits that were registered on a burn date. We still get out and do our compliance checks. We were almost there at 100%. And we do have a few warnings we issue and citations for people that aren't following the rules, but in general, it's moved along pretty well. So to continue the EMS statistics for 2019, here again, you can see this chart is the response by our ambulances from the same fire stations that our engines are located, and our Medic 1 at Shipyard and our Medic 5 at Hilton Head Plantation. Once again, you can see the run totals there that they are our two busiest units. And then the other fire stations, it levels off and the workload is somewhat consistent among those other stations. And that's been our history for my 30 years here. Medic 1 down there at Shipyard in the summertime with all the visitor population down along Pope Avenue in the south end gets busy. And then as the growth has moved to the north end over the last 30 years, the Hilton Head Plantation ambulance is very busy out of that location along Main Street and some of the facilities there they provide response to. Likewise, our station zone medical incidents, you see the same trend, station 5 at 24%, station 1 at 22%, and then the other stations are somewhere between 10 and 15% generally of run total. And this is the outcome of our EMS calls. As we said, we had almost 6,500, 5,900, and so just to give you a snapshot, at the end of the call, we transported 4,217. And then as the chart goes down, there are no treatment, no transport. Sometimes it's a lift assist. Sometimes false call. So you can see the disposition there. We'll talk about interfacility transports a little bit later. That's just kind of a summary to show you what the 5,000 we run, what they end up being. Likewise, on our patient care reporting, the paramedics respond to the call. Dispatch gives them initial protocol. This chart shows you the protocol that dispatch is giving based on what they get from the caller. It shows you that general falls, we do run to a lot of injuries from falls, and you can see just the different coding there, breathing problems, fainting. Just kind of gives you a snapshot of how our dispatchers are coding the call when they send the ambulance. So we've talked about Narcan and the opioid problems we had going back several years. EMS division has been charting that, and you can see we made, compared to where we were in 2017. 2019 ended up dropping back down to 35, and these are the patients that we received Narcan as an indication based on their condition. So we'll look at a chart in 2020 that unfortunately the numbers have come back up, but I think based on the stress in the world right now could be a reason for some of that. So we'll look at that. But without the pandemic hitting, it would have been interesting to see where we were this year. So we were improving. We've talked about interfacility transports and the burden they put on fire rescue. Last year in the September meeting, some of you may recall that we had reported this, and we indicated we were going to follow the data through the end of the year and then speak with the hospital. Well, at the end of the year, about the time we kicked off the new year, a pandemic hit in March, and we had never actually sat down with the hospital, but we have recently engaged them about this number trending up and the burden it places on fire rescue when it takes one of our ambulances off the island. So the chart clearly shows the increase, but do know we are working with the hospital. We've had a couple meetings, and we are engaged to try to correct this trend. We're still proud of our cardiac arrest survival rate. As we've said, we've got a 55% running average over several years. And that's, as we continue to say, one of the best in the country based on all our initiatives. How 2020 and COVID will play into this with the how it's played out in the community and the engagement of people, we'll see. We are tracking it, but through the end of 19, we had still maintained our good level of service in that area, something to be proud of. So as I mentioned, part of this presentation is to comply with our accreditation. And in addition to that, we are obligated to provide our elected officials our response times. And this chart is taken directly from the accreditation model, so I present it to you as we're required to present it. And I've highlighted the red section. And as you can see, we look at our alarm handling time, turnout time, travel time, and we document a total response time. So this chart represents a fire-related call in which the engine ran emergency from the fire station to the scene, because we do reduce our response if we get indications through our dispatch that there is no emergency. We have policies in place. So these at the bottom of that chart where you see the number equals 1429, that's how many calls were calculated in this total response time. So on the left is the alarm handling benchmark time of 1 minute 20 seconds, our turnout time of 2 minutes 30 seconds, and our travel time of 5 minutes Those are the goals we have as a department, and our total response time for a fire truck then is 8 minutes and 50 seconds. So if you go back to the red box, you can see right now we're meeting that at 8 minutes and 38 seconds. So that's good. Our travel time has been around 5 minutes and 32 seconds, and our turnout time has continued to be around 2 minutes and 40 seconds, and that's one area we're working on with the crews. And related to turnout clocks, we put a clock in each station that starts counting down when that station receives the call. So the crews have a visual reminder of where they're at in that time period to try to get out the door and get the wheels rolling. And our alarm handling time of 1:20, we generally are between 1 minute and 1:20, so we're pretty good there. So the summary of this chart is we are meeting our response goal for a fire apparatus responding emergent, and we are updating our standard of cover document that I hope you will all see later this year, early next year. And that time may be adjusted downward to recognize our meeting this goal we have set. So this is our EMS chart. Same chart, little bit different benchmark times. The alarm handling time is the same, but our turnout time is lower because paramedics are not putting on the firefighter gear before they get on the apparatus and respond, so it's a little lower. Travel time is consistent because our community is consistent. They're traveling the same roads. So our goal here is 8 minutes and 5 seconds for an ambulance responding emergent from the time the call is received until they arrive at the curb. And you can see we're meeting that in the red box at 7:59 down at the bottom, with the total number of incidents being calculated at 5,572. So there again, we're doing well, and I think we'll look at this time to see if we should adjust it downward to continue to have a goal that we strive for. And as you can tell on the chart, we're at 2019. The next box moving over to the left as you look at the chart will be this year, 2020, and then the accreditation team will come back in to evaluate our department in the fall of 2021. So we build this chart out over 5 years for them to review. So right now our response times are consistent with our goals and meeting what we expect. So real quick to finish up 2019, like I said, you all have the annual report. We did hire a new deputy fire marshal. He joined us in January of this year, right at the end of the year. Becky Nugent came on as a new comms manager. We had 12 new firefighters join the department throughout the calendar year. Back in the spring, which I reported on last September in 2019, last time we were together, we did improve our ISO classification from a class 3 to a class 2, which is an improvement. We got the new computer-aided dispatch program implemented, and that was funded at 80% by the state E911 funds, but it brought us a computer-aided dispatch program that's more state-of-the-art. We were using a system that was greater than 20 years old, almost 25 years old. We also used grant funding from the state to purchase a rescue boat and trailer. So that supports our USAR team, but it was grant funded through the state, but it's also deployable here on the island if we need it for flooding or weather events. So it's a good tool to have. We implemented our new patient software reporting system back October of 19. We worked with Beaufort County and implemented the state-of-the-art new E911 phone system that's out there from, it was a Motorola product, and that was a effort consistent with Beaufort County, and there again, it was funded by the state E911 bank. We implemented the Pulse Point app that we talked about, and then in September, I told you the new fleet was coming in of ambulances, and we got all 10 of them, and they were all placed in service by October of 2019. So, any questions on that? I know I'm moving fast, but I know you have an agenda after me, so. No questions?
No questions.
Okay, I'm going to move right into the mid-year update for this calendar year, 2020. Started off normal, but changed course dramatically in March. So if you look at our incident count for the first 6 months, people have said, well, what did it do to our response? Well, as you can see, we're down about 300 calls, give or take. And if you figure everything changed in the middle of March, of course, the golf tournament, April was shut down pretty much. So that, I think our call volume shows that trend, that things just really came to stop in mid-March through the early May, and that's reflected in our calls. Likewise, the chart I show you, the half-year total of EMS calls versus fire calls, and we're still about that 75-80% EMS versus fire. The EMS call chart with the false calls and the other type calls we code related to good intent. This here again, it's showing the same trend as we've had, typically does. The first 6 months of this year, we've had a total number of calls coded as actual fires is 38. And this is the same chart where we show you property loss over 25,000 in the first 6 months of this year. And there again, the majority, I think all of them but one, was single family home. We did have a fatality in the single family home back in January, fortunately. And then we had major fire there in Palmetto Dunes of an apartment building. And we've only had one commercial fire this first 6 months. Open burning is moving along again, and crews are out doing the compliance checks. No issues to report there. We did make up some days. We canceled the open burning back in March and April to try to let things settle down and figure out where we were with everything. And so we made up those dates back in June and July when things improved. So these are our mid-year updates on EMS calls, disposition. You can see down there the interfacility transports are at 31. So that's, if you double that for half the year, we're still at 60 a year. So we'll continue to talk to the hospital and work with them on that issue. Now here's the chart. The EMS chief just wanted to point out, we do at times, based on the patient's condition, take them directly to Savannah to the trauma center. That's based on the paramedics evaluation. That could be based on, like today, right now, if we needed a helicopter to fly in here to get a critical patient, that's not going to happen due to the weather. They won't fly in this type of weather. So we will take patients by ground to Savannah, and it happens frequently, but those numbers are not included. These interfacility transports that we've seen trend up are specifically related to going to the hospital, to their facility, and picking up a patient and moving them to another hospital, typically either Savannah or Charleston. Like I said, we're going to continue to work with the CEO of the hospital on these numbers. So I mentioned the Narcan, the opioid epidemic that peaked in 2017. So the numbers were down in 18 and down again in 19, as I showed you previously. But double the number at 2020. That's just the mid-year number. You'd be up close to 46, which would be a slight increase. And there's a lot of stress out there, obviously, related to everything we're dealing with. So we'll have to keep an eye on that. That just kind of gives you an overview. Did have this picture just highlights, we did have a couple search and rescues out along the beach this summer. We have good teamwork with Shore Beach, Fire Rescue, Sheriff's Office, Coast Guard came in a couple times. So as we headed into 2020 last year, we came through January, we had our awards banquet, had a leadership retreat, and then March hit. Everything changed, and I want to give a shout out to the staff here at Fire Rescue. All of them faced a lot of challenges, some degree, we were ready for this. In a lot of areas, I don't think we were, either as a department, as a state, as a country. But our EMS chief started ringing some bells back in February. He's very connected in the EMS world, and he was hearing some out west. And he started coming into my office in February. We started discussing this, and this chart just kind of highlights some of the initiatives we took early on. I think some of them played out well as we look back now over the 6 months. Some of our initiatives helped set the stage, I think, for some progressive response models that we utilize, policies. So just so you're all aware, so basically in the middle of March, we shut down headquarters except for the critical staff, and we set up an EOC in the classroom. Tom Dunn was our emergency manager, and he headed that up. And we broke off into basically a planning group to start making sure we had our policies in place to protect our people and to serve the community. And we set up a group on logistics, which was just searching for PPE to make sure we could get the proper PPE we needed for our troops, which, as everyone found out, was very difficult to do. So they were using all sorts of different methods to track down PPE, and they had to verify sources. There was a lot of people out there trying to sell things that maybe weren't exactly up to par. So they all worked very hard. It was very stressful. Obviously, I had stress at home. So I get my hats off to all the staff up here. They really did a great job, I believe. If we made a mistake, we learned from it, we moved on, we educated, and we improved. That's all we could do. I've been here a long time. It was my first pandemic, so everybody worked really hard, and Tom Bouthole, our EMS chief, reached out to the West Coast early on in Seattle where they were dealing with the initial outbreak, and we got some insight into some things we needed to do before it moved across to our area. So we officially, if you can see on that chart, we opened our EOC on March 17th. And we had a meeting with all the nursing homes and assisted living facilities in March. So we were really taking some steps to try to make sure we were ready to coordinate our response with our community partners. Like I said, I just want to give a shout out to all the members of Fire Rescue, both the line personnel that had to respond and the staff up here. They all did a great job to get us to the point we are today. So what have we done here? We have transported or came in contact with 497 patients that screened positive for the COVID dispatch. That doesn't mean they were necessarily positive COVID, but they had met one of the criteria that we were using in our dispatch protocols. We feel like we implemented some procedures that I don't think other agencies did, and I think that's helped keep our troops safe. The picture there is of monitoring. We implemented the temperature checks early on. You don't see or hear much from our dispatchers, but I can tell you I believe if my date's right, they started wearing masks March 18th at our dispatch center. We all know wearing a mask is not a great time, and to set up there for 12 hours and have to communicate over the phone and radio, my hat's off to them. But they understood why we needed to do it. We couldn't risk someone coming in there and having to quarantine 2 or 3 shifts of dispatchers when we only have 12. So that's an initiative we took early on, and then we obviously expanded that out to the fire stations, to headquarters, to town hall. And I think it's paid dividends. We've not had to quarantine a large number of firefighters. We've had a couple that have tested positive, and we handled those appropriately, and based on the mask and our other procedures, we didn't have to quarantine 8, 10, 15 firefighters that you were reading about through this. So as we continue forward, we're still working on the PPE. That's a picture of everything our troops wear when they're out in the field and they have a patient that meets our criteria. So they are wearing gowns. We have a bouffant they put on their head. So very aggressive PPE. like I said, some of this was not easy to get. So, but I want to give a shout out at that point to Steve and Josh and to town council. We were told to do what we needed to do. The team did it. We weren't questioned on what we needed or what we were buying. Trusted us to get the job done, and I think the team did a great job in that. So we think we're in a good spot. I can tell you the N95s are still an issue for across the country, and we're still working to get more of those. So to help through all this, we did contract with Dr. Kelly Boothaway as a nurse practitioner. She works for both the town and fire rescue to help us monitor our patient. And today she's had 157 patient encounters. This was both town employees and fire rescue and their family members. She's helped us order over 106 COVID tests, and we were able to get COVID testing back before the hospital got ramped up. Now, it wasn't easy and it took some time, but we were able to get tests for our people. As you can see there, out of town staff and fire rescue, we've had 5 positive results, and they were handled effectively. We feel this has really helped us because of the when you're dealing with patients and you're screening them for not only COVID, they obviously have private medical issues, and we felt like we needed somebody to help us, that wasn't a task someone in fire rescue could take on. So Kelly's been a big benefit to help us navigate this. And I would tell you today, I know, we're open and the town's open. I don't think the town of Bluffton is open yet, and I don't think the county of Beaufort has opened their offices. And I think, like I said, to the town staff and Steve and Josh and Angie that supported us, we've implemented procedures, and right now they seem to be working, and we're able to stay open and operate, with some restrictions in place, with good policies, with practices we put in to limit interaction. But so I think that's a good sign of what we've done has worked. So where do we head from here? Obviously, the COVID pandemic is still here and will be for the foreseeable future. So we still are going to address that almost every day in some form or fashion. If you haven't seen it, Fire Station 2 is well on its way down in Sea Pines. And we are still working to implement our strategic plan recommendations. We slowed down on a lot of initiatives, in March, April, May, June, but we've slowly started to ramp back up. We are in the process of updating our community risk assessment and standard of cover to go along with our reaccreditation that happens. And part of that reaccreditation process is in January, we'll start developing our self-assessment manual, which is us reviewing the 250 plus criteria to earn accreditation. We have to write to each one of those criteria to show we're meeting it. And we've also started updating our internal policy and procedures manual and EMS protocols. That's a picture of Station 2 there a week or so ago. So they're making progress there. They're shooting for a May 21 opening date. So I always say thank you to Town Council for your support, what you do, support us and our mission, and the administrative staff at Town Hall, especially over the last 6 months. I think we've tried to do our best and carry out our mission, and I hope we've done everything we could to satisfy that from your standpoint of Town Council, the elected officials, and town staff. So I told you I'd be as quick as I could. And any questions?
Tom, you have any questions?
Yeah, I do. Brad, thank you very much. The work that you and your staff does certainly makes the entire island proud, and I can't thank you enough. This question is a little bit outside of your mid-year report, Brad. Through the first 2 months of our 2021 fiscal, EMS revenues down a little bit, about 6%. Is that a function of people being reluctant to go to the hospital?
Yeah, we saw that in March. So with our numbers down and with some transports down, there would be some revenue decline. Yeah, there were people back in April who did not want to go to the hospital, obviously. So, but I would have to, we can look at the numbers at the end of the year and see where we're at. I'd have to probably get finance involved. Did that answer your question?
Tom?
I'm going to
Okay.
stop sharing the screen if that's all right.
Okay. Tom, you have any other questions, or you good?
Nope, that's it. Mark, thanks.
No problem. Tamara, do you have any questions?
I don't have any questions. I just want to say to Chief and the entire department that they, in fact, are an absolute shining example for Hilton Head in terms of excellence. And what they do for our community is truly and appreciated. And thank you for all you do.
Thank you. We have support of town council. We have support of Steve and the executive staff at town hall. So we appreciate that, and we strive every day to do the best we can.
All right, Glenn, do you have any questions? No. All right, I just have one question. There was a time there was a emergency on Burke's Beach, might have been earlier in the summer, where the trucks had to get down there and it was congested. My question was, I think they towed out a bunch of those cars at that particular time so that the trucks could get down there. My question is, do you have any recommendations of what we need to do to improve Burke's Beach Road?
No, I haven't really thought about it. I don't know.
Okay.
Yeah, I mean, we go down there for beach access. That's one of our primary beach access points. I don't know the call you're referring to specifically, but so no, I mean, I haven't. Be glad to discuss it, but I haven't thought about it. I don't know that I have an answer.
I was just curious because I remember for some of the tow trucks, they had to call a bunch of tow trucks to get the road cleared because it was blocked. So the fire apparatus couldn't get down to the beach. I guess somebody had an emergency down there, and there's no way to turn around. And I think they moved it to across the street. And my question would be, in terms of how do you back up, move in and out quickly so you can meet the time that you need to get in and out for a service call. But that's something that I guess we have to look at and come up with a better idea of how we can serve better in that area. Okay. But I also want to say too, this will possibly be my last community service meeting with you, Chief. And it's been an honor to work with you over the years. And as you know, I'm a big fan of your work, and I've seen how far we've come over the 8 years of my term. And I truly appreciate the work you do. And thank you.
Well, thank you very much. I know for your time, you've supported us, and I appreciate that. We always appreciate the support, and we do everything we can to uphold the values and expectations of the town as a whole. So, but I do appreciate your service. Thank you for your time and your insight and recommendations. I appreciate it. Enjoyed working with you on this side. And we'll see you on the other side.
Thank you, Chief.
All right. Thank you all.
All right. Okay, the next item, I believe we're dealing with the budget with the Recreation Center. Do we have anything to present to us at this time? Good morning, John.
Yes, good morning, Mr. Chairman and members of the committee. This was an item that had previously appeared on a town council agenda a number of weeks ago, and council asked that it be removed for some additional discussion. So it's appearing on your committee today. We want to make sure that we have an opportunity to answer any questions that you may have, although I did have an opportunity to make some statements with regards to what was going on at the last town council meeting. So hopefully you had an opportunity to review the memo that's included in the backup today. What we want to highlight is primarily with regards to Parks and Recreation, two specific aspects. One is a request for approval. The other is more just kind of an update or a notification. So let me begin with that aspect of it. With regards to the park properties that are located on the island that are owned by the town has begun providing maintenance of those properties and did so beginning July 1st. And it's our intent to continue to provide that maintenance going forward, at least into the foreseeable future, absent any changes by town council or changes with the county and their relationship. The other item that we wanted to talk about is a request for supplemental appropriation and funding for the Island Recreation Association. They are, of course, the recreation service provider for residents on the island. Typically in the past, they've received funding from Beaufort County, both for operational expenses and also for programming relative to aquatic education. During the county's most recent budget process, they kept in the funding for the aquatic education programming. However, they cut the remainder of the funding that is provided to Island Rec for their programming needs. And so we are making a recommendation that Town Council authorize a supplemental appropriation in the amount of $140,000. This would make Island Rec whole in terms of the hole in their budget that was created by the reduction in that funding. We believe that that's important in order to ensure that the amount and level of services that are provided to Hilton Head Island residents continues to remain at its established levels, and that funding is available within our existing budget, so it wouldn't have any kind of detrimental impact to our finances going forward. And with that, I'll be happy to answer any questions that you may have.
Okay. Tom, you have any questions?
No, Mark, I don't. This went through F&A committee as an attachment to the proposed budget amendment. And it was pretty fully vetted there. And what Josh says is absolutely accurate. We're shifting $1,387,000 in public safety funds and allocating it to 4 areas. And this $140,000 is one of the 4 areas. So it has absolutely no impact on our budget.
Okay, thank you. Tamara, do you have any questions?
I do have a couple. So my understanding of the $140,000 that had typically been received by Island Rec Center was the Island Rec Center had requested it from the county annually, and that was something that they kind of had done together. Has there been a request by the Island Rec Center to the county for those funds?
Yes, they made a similar request back during the county's budget process, and ultimately that funding, which had been provided in previous years, was ultimately pulled from the budget. That funding is an acknowledgement that the county pays for all recreational activities across the entire county. So at their centers in Bluffton, at their centers north of the Broad, and it developed as an acknowledgement that there is recreation activities that go on in the island, and since island residents do pay into the county, that Island Rec should receive at least some portion of funding so that they're kind of kept equal with the recreational activities that are provided across the rest of the county. So that's how that funding came about. That request was made this year, but ultimately was not granted, or was ultimately stripped out of the budget by the time it was finally adopted.
But the other areas of the counties, those funds were left intact?
That is correct.
Okay. And moving forward, so is this a one-time supplemental, or is this going to be built into our budget year after year?
Going forward, as long as our existing relationship maintains as it is today with the county, this would be something that we would build into the budget for future funding.
Thank you.
All right. Thank you, Josh. I don't have any questions. All right. Do I have a motion for approval? Tom, you're on mute. Couldn't hear you.
I would move that we approve the $140,000 funding to the Island Recreation Association as presented by Josh.
Okay. If you raise your hand to vote, move forward. Okay, I support. Aye.
Aye.
Okay, all three. Thank you. Okay, new business, Burke's Beach on-street parking. Does the town have anything to present to us on that? Just, okay. I think I saw Jeff for a second.
Good morning, Mr. Chairman. Can you hear me?
Yes, sir.
Hi. Yeah, this item was put on the agenda, and my understanding is that it should be presented to the committee and then further on to town council to see what we should do with the on-street parking along Burke's Beach Road from William Hilton Parkway down to the permanent spaces by the beach. The history of that is that this is a county road maintained by Beaufort County. There was a wide paved shoulder originally put in there, I think, for pedestrians or bike travel down to the beach. When the park was constructed, the initial construction of the soccer fields and people using the fields led to people parking along the road shoulder there to walk to the soccer fields. I coached my kids' soccer back in that time period, and to alleviate that, the town constructed 51 spaces between the soccer fields and US 278. Hoping to alleviate the need for people to park on the side of the road to walk over to the soccer fields. At that time, the town also constructed a pathway from that parking lot down alongside the soccer fields to get to the beach. So hopefully folks could, if you were riding along William Hilton Parkway pathways and you wanted to go to the beach, you could get off and use that pathway and not have to ride on the road if you chose not to. Since then, I understand lots of folks park there just to go to the beach. You turn down Burke's Beach Road, you want to go to the beach, you see a wide shoulder, people are parking there. We have no parking signs, and we have since instituted a barrel and rope system to further prevent that. But as I understand it, the issue is, would the town like to formalize parking there or ensure its prohibition through better signage, pavement markings, and enforcement?
Okay. All right. Tom, you have any questions or suggestions? Oh, you're mute.
You-
Tom, you're on mute.
Tom, you're on mute. Okay, there you
Yeah, I'm sorry. Mark, I was down there yesterday afternoon for about 45 minutes early in the afternoon and saw a lot of activity. Most of the activity was from the parking lot and pathway accessing the beach. There was some minimal activity on the road. That being said, it just seems to me that parking on the shoulder is not desirable, and I would defer to Tammy, who's got a lot more experience on Burke's Beach Road and any issues pertaining to foot traffic and parking. But it seems to me that keeping it the same way it is and requiring beach access parking through Chaplin Park would be more than sufficient, Jeff.
Yeah. Okay. Thank you, Tom.
Yeah.
Ms.
Thank you. And thank you, Jeff and Tom, for your comments. The fact is that Burke's Beach Road, as Jeff accurately pointed out, was not set up to have parking along the side. And during this time, which is more of a shoulder season since Labor Day, there are less people obviously coming to the beach. But over the course of this past summer, while Burke's Beach Road was blocked off, with two exceptions that I can think of, and I think it was actually the same person, there were 0 complaints about having to park in Chaplin Park and use the pre-planned parking to access the beach, as well as the community park And so there seems to be really no harm done with going back and doing what is the obvious and creating a safe road down Brooks Beach to travel. Because previously, before this no parking was instituted, it's my understanding, and it was clear, there was no parking there. People have started parking there. They
I don't know what's going on.
beach and sport area all through the road and walk down the center. And over the course of time, what has eventually happened is that the side roads, what used to be 1 through 5, and now have wonderful beach names, Seafront and Barrier Beach Cove, etc. So those are now being developed, and they're being developed as homes with rentals. And so those folks too now are walking to the other side of the road. So Burke Beach Road is a very dangerous place, and the extra parking, if it were to be reinstituted, is an absolute disaster waiting to happen. And as Mark correctly pointed out and asked Chief about, the idea of fire trucks being able to, A, get to the beach access, but also, and importantly, that would save you oceanfront homes, this traffic, these people walking in the street, and the extra cars parking there just delays that. It's undeniable that it's a safety hazard on a number of different levels. I think that you received emails from a number of residents in the area. Who represents the seaside area, and I think very eloquently spoke to the history of along Burke Beach Road there, and then further problems that are created down at the end of the road with people bringing their beach equipment and dropping them off and then trying to figure out how to turn around. Other residents have written in by virtue of the survey. I'm getting emails and text messages from people who say that they did call in to speak and have sent other emails. But overall, I think that we've seen pictures of how this functions during the height of the season. Bottom line is Joplin Park is really well designed with sufficient parking to satisfy the beachgoers as well as those who come to use the athletic fields with no trouble. And so I respectfully request that everyone vote to maintain the no status of Burke Beach Road, and that we make sure that this residential neighborhood and those who use the street, including the fire department, safe access down the road to their homes and to their businesses. So I'm not sure if anyone has any questions for me, but I travel it daily several times, and I'm happy to speak to anything that's any question anyone may have.
Okay, thank you, Tamara. This is what I think this needs to happen. I think we should keep it as is for now. My opinion is we don't need code enforcement down there. I think it needs to be redeveloped. One thing I spoke to Steve about is there should be a roundabout installed where people can drop off and then park in the Chaplin Park. I think there should be a concrete shoulder for a bike path only to eliminate anyone trying to park on the side of the road on Burke Beach. But long term, there needs to be some type of plan and vision so that we don't put code enforcement in the role of trying to tell people no when they have only one option, which is to park in the parking area. So I think that's the long-term goal of what we should be looking at. As in terms of short-term, right now, I think what we have is sufficient. Keep the permit, keep the whole area blocked off and let everyone park in the Chaplin Park until next year. And then hopefully by next year, Jeff, you and your staff can look at ways of making it easier for everybody to use it because, the season will be back around before you know it. So we must come up with a plan to deter people to park on the side, and hopefully there might be some money in the budget that we'll be able to get that done in the future. Oh,
Mark,
Tamara?
can I
Go ahead.
just, another thing I wanted to point out is that as these streets start to develop, and as we know how it's been returned to the neighborhood and developing as such, the idea that anything along Burke's Beach Road would be opened up and more urbanized is against everything that Hilton Head stands for. Taking away trees, adding pavement, just as a disservice to the folks who live back here. You would never think of doing this behind a plantation gate. You would never think about doing this along Singleton Beach Road. And so Burke's Beach Road should be off limits as well. There is a bike path. There is a footpath, as I've remarked, from William Hilton Parkway along the side of the Chaplain Park down to the beach access, which is sufficiently wide to satisfy bikes and children and all of the rest. In fact, if anything should be happening, what I truly believe, in keeping with Hilton Head's brand, is that that area that has been pushed back by cars parking along there should be replanted and more greenery installed so that the residential neighborhood stays intact and, again, that the road becomes safe. Furthermore, in terms of parking, the idea that we would be at this point even thinking, even remotely breathing a word about creating more parking in light of the fact that we have a parking study, and in fact, that parking study was briefed to us on the Public Planning Committee just a couple of months ago, or maybe I guess it was August, and that there's no additional capacity being looked at for creating parking, further points to Burke's Beach Road needing to be landscaped and a safe residential neighborhood provided for to those who live in the area. So,
Okay. The only reason I brought that up was because the fire truck, I'm trying to figure out how does a fire truck get down there and get out safely, and then do what they need to do in case of emergency. Because the challenge, in my opinion, it would be backing up if somebody got to get out, go back, tell people move out the way. But I'm not an engineer, but I think that's why we have some staff engineers who can look at the whole idea. And in the future, that should go through the process. I know Glenn had a question. Glenn, go ahead.
Thank you. Jeff, I would encourage you to work on some engineering study to this. You hear the problems coming through loud and clear from council, and I would recommend that this be added as a new CIP project, and that you need to work with Scott Liggett and others to work about getting that in place to move it forward. I wish it could be done immediately, but it sounds like that's not likely, but it does need to be engineered in an appropriate way. And I know that you're the man to get that done for us. Thank you.
So at this time, do I have a motion to keep everything as is for now? Tamara?
Mark, I make a motion to keep Burke's Beach Road a non-parking road, that there be no parking alongside Burke's Beach Road on either side.
Okay. Do I have a second?
I'll second that.
Okay. All in favor? Aye.
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 Tamara was there. Okay, good. We have unanimous vote. Thank you. All right. Let's see. I believe that might
Thank
be
you.
it. Let me make sure. Okay. Do I have a motion for adjournment?
I would move to adjourn.
Okay.
Second.
Okay, thank you, Tamara. All in favor? Aye.
Aye.
Tom, Tamara. All right, thank you all. You have a good day.
Thank you.